This is a message for patients with inflammatory bowel disease who might be concerned about how well controlled their Crohn's disease or ulcerative colitis is. And it's to do with inflammation, because inflammation in the gut, in the bowel, is the thing that causes the damage over time. It's the thing that drives not just the symptoms inside and outside the gut, it's the thing that drives the complications inside the gut, from scar tissue to strictures to fistulas that may ultimately result in the need for surgery, etc. But it also, over months and years, can increase problems with the heart and the brain, with increased risks of heart events and psychological dysfunction, etc. So how do you know if your inflammation is well controlled? Well, we don't have a perfect way of doing this. We know that we can do an ultrasound or a colonoscopy or an MRI scan, but actually the simplest thing that we can do is check a fecal calprotectin test, a poo test, to measure this protein called calprotectin, which, if the level is very low, then more often than not, vast majority of the time, then the inflammation levels are low. It's not to say that there aren't problems with Crohn's disease or ulcerative colitis, but the inflammatory component is typically very low. If the calprotectin is above a certain level, and 250 is a reasonable place to look, if the calprotectin is above 250, then typically something needs to happen, something needs to change. And so what we do in Edinburgh is we tell everyone that a calprotectin cutoff of 250 micrograms per gram is the threshold at which, above that, some action needs to be taken. Now, that might be a change in therapy, it might be a colonoscopy, it might be an optimization in therapy where the dose is increased. It might simply be repeating the test in a wee while, but it shouldn't just be documented in notes that the calprotectin was high and we'll just crack on, because we want to improve things. So if you're a patient living with Crohn's disease or ulcerative colitis and you want to know, then you should ask to get your calprotectin checked. And if you've had it checked, you should ask to know what the result is. And if your calprotectin is above 250 micrograms per gram, you should ask what is going to be done about that, if something can be done about that. And then you are empowered to help take action into your hands, hopefully to improve things moving forwards. So hopefully that's a simple thing. It's a very widely available test now, not completely universally, but for the most part it is. Collecting a poo sample is not the nicest thing to do in the world. We do appreciate that, but unfortunately there's nothing really that comes close to it at the moment in terms of the accuracy for this level of screening. So if you want to know how well controlled the inflammatory component of your inflammatory bowel disease is, that's the bit that we can change with the medicines that we use, then ask to get a fecal calprotectin checked and then see what the number is. If it's below 250, broadly, you're probably doing okay. If it's above 250, then usually something needs to change. Okay, bye-bye.